Hello, and welcome to Blue Briefing, our video look at an important paper in the American Journal of Respiratory and Critical Care Medicine. Today we discuss a multi-center randomized controlled trial of Zephyr endobronchial valve treatment in heterogeneous emphysema, or TRANSFORM, by Samuel Kemp and colleagues. Development of hyperinflation in patients with severe COPD is an important problem since it is associated with increased dyspnea and decreased exercise tolerance for these patients. Unfortunately, inhaled medications for hyperinflation are limited in effectiveness, and though lung volume reduction surgery benefits some patients, it is associated with morbidity and mortality, so relatively few receive it. An endobronchial valve has the potential to improve hyperinflation without the risk of surgery. It is a self-expanding, one-way valve and works by creating a seal that prevents airflow into the target area while allowing trapped air to escape. The valve is placed bronchoscopically via a delivery catheter into the airways leading to the target lobe. To date, several single-center studies have evaluated endobronchial valves and found benefit in quality of life, walk distance, and PFTs in patients with heterogeneous emphysema. TRANSFORM is important because it is the first multi-center trial of the Zephyr endobronchial valve. Enrolled patients had to be ex-smokers with heterogeneous emphysema with both severe obstruction and air trapping. They also had 6-minute walk distance from 150 to 450 meters and an absence of collateral ventilation, which suggests they might benefit from the valve. Assessment of presence of collateral ventilation was done using a system that connects to a balloon catheter that occludes a target lobe to measure pressure and flow, allowing collateral ventilation to be quantified. Patients were randomized in a 2-to-1 fashion, with 65 randomized to endobronchial valve placement and 32 to standard of care. The primary study endpoint was percentage of subjects in each group with significant, defined as greater than or equal to 12%, improvement in post-bronchodilator FEV1 at 3 months. In the IntentiontoTreat analysis, 55% of patients in the endobronchial valve group had significant improvement in post-bronchodilator FEV1 at 3 months, compared to only 6% in the standard of care group. In the per-protocol analysis, 2/3 of the valve group had significant improvement in 3-month post-bronchodilator FEV1. The endobronchial valve group also had both statistically and clinically significant improvements from baseline in 6-minute walk distance and residual volume compared to the standard of care group. There was also improvement in quality of life in the valve group, as measured by St. George's Respiratory Questionnaire. Finally, there was similar improvement with valve placement in the multidimensional Bode index. As in prior studies, the most common serious adverse event in the endobronchial valve group was pneumothorax, occurring in 29% of valve patients, with median time to pneumothorax onset of 1 day. Overall, there were 44 respiratory-related serious adverse events in 31 patients who received valves, compared to only 4 events in 3 patients in the standard of care group. Limitations of this study include short duration of follow-up, only 6 months. In addition, only 35% of screened patients were enrolled, so there are still many patients with severe COPD who may not be appropriate for this treatment. In summary, TRANSFORM is the first multi-center randomized trial showing improved lung function, exercise tolerance, and quality of life with Zephyr endobronchial valves. For more details, please read the article by Dr. Kemp and colleagues, as well as the accompanying editorial by Dr. Jerry Kreiner in the December 15, 2017 American Journal of Respiratory and Critical Care Medicine. I'm Nitin Seam for Blue Briefing.